It's Thursday. That means Dr. Joe is here to answer your pet questions. If you have a question, you can still give us a call. The number is 460-KJRH. And Dr. Landers has brought along Denver this morning.
Denver is an amazing dog. He's been with us for a couple of months. He's a chocolate lab. He's about 2 years old. He came to us, he had his collar ingrown, he was really underweight, and he had heartworm. So we've been kind of fixing him up for a while. You couldn't tell anything's wrong. He is just amazing. He has learned, he's sitting and staying here, he's not on drugs or anything. It is just amazing how nice this dog is.
A very sweet dog, so he's had a share of problems.
He has, and he's really turned out just super nice. You know, a lot of these dogs, unfortunately, you know, a lot of times they're not as friendly, and they don't sit here, and they get a little hyper and stuff, and he's just a great dog. So
Seems like it. Seems like
really
it. So he's up for adoption now.
He's
Where?
up for adoption. He's over at Heritage.
Okay.
And he's also at animalaid.org on the net. So this is just a wonderful lab. If you're looking for a calm lab that's, you know, a couple of years old, and anyway, just a real good dog. I can't say enough about him. So.
All right, let's go to the phones. First up today, we have Kim in Skiatook. Good morning, Kim.
Good morning.
Hi.
What's your question?
Yes, I have an elderly husky that's almost 14, and she's got a lump on her left side, and I'm just wondering if I could tell if it's a tumor or a cyst.
You know, most of the time what we do is your veterinarian can do this. They'll kind of clean it, and they'll take a little sample with a needle, and a lot of times they can put that on a slide and tell you what's in there. Hopefully it's just a little fat or a little cyst or something. 14 is up there quite a ways, but absolutely take them to your veterinarian and just have them take a little sample of it, and a lot of times they can tell you a better prognosis of what that is. So.
All right, next up we have Jane in Tulsa. Good morning, Jane.
Yes, I have a question about heartworm prevention.
Yes, ma'am.
My previous vet that retired would allow me to purchase one heartworm pill for a 100-pound dog, which I could then split in two to give to my two 50-pound dogs, which saved us a ton of money, and now we can't find a vet that will allow us to do that. Do you know why that is? Yeah,
that's called off-label. Technically, that's illegal. Now, a lot of times in veterinarians, you're getting into an extremely sticky place here, but for the most part, that's called off-label use. You have to have what's called a veterinary patient-client relationship, that he knows your animals and weights and things like that. That's pretty common a lot of times in doing that, especially if people that have multiple dogs and stuff. That is, you need to establish a relationship somewhere and talk to your veterinarian about that, because, yeah, technically you're not supposed to do that. It's a medication, FDA regulated. It needs to be used in a certain way, and that is something that you need to talk to whoever it is that you're using now and kind of do that. In certain circumstances, things are used what's called off-label. For instance, everyone kind of knows this penicillin was labeled in 1950 at a certain rate, and they found out that was about half of what you need to use. So penicillin is always used at a higher dose. Not a big deal, just legality here. So.
All right, let's go to Tulsa now and talk to Samantha. Good morning, Samantha.
Good morning.
What's your question?
I was wondering, is there a special trick that you could possibly get a puppy on a sleep schedule? He wakes up every day at 7 a.m.
Yes. You know, usually there's something that either wakes them up. Sometimes it's an internal clock. And a lot of times what I'll tell people is you have to you can't run to them right when they kind of bark and stuff, if that's what's kind of probably, if that's what's happening, where they bark and they wake you up. And so you want to keep them from kind of barking. A lot of times just a little bit of persistence and being very, very regimented and doing the same thing. A lot of times I'll let them go 10, 15, 20 minutes and try to push them out to 7:20, 7:30 so that you can get them, you know, they'll bark and stuff, but you don't go in there. Sometimes you do go in and you reprimand them if they get out of hand a little bit, so that they kind of know that we're not coming when you bark. We're coming for you, but it's on our schedule. So, and a lot of times as they get older, that gets much better.
Right. So don't reward the barking, basically.
No, and don't go very first thing, because that just, what they're doing is they're training you.
Sure, right, exactly. Should be the other way around.
That's right, that's right.
All right, so again, if you'd like to adopt Denver here, you can call Animal Aid at 744-8280 or log on to animalaid.org. Dr. Landers is here every Thursday to answer your questions.